Apparently, emergency contraceptive pills came into the limelight or came into existence out of authentic scientific research, proven, tested, and measured, meaning it's a safe way to prevent occurrence, or rather, in secondary prevention of pregnancies. Now, one of the beautiful minds behind this invention is one Dr. Albert, a Canadian gynecologist who existed in them days. I'm not sure whether he is there right now. Maybe you guys can research and tell me in the comment section. Yep. You guys I've heard at some point someone saying use of P2s can predispose you, or rather can give someone an upper hand in the development of an ectopic pregnancy. And by the way, what is an ectopic pregnancy? Yep. Or else you also have heard someone say you should not take maybe a certain number of emergency contraceptive pills within some period of time. Now, those misconceptions are what has brought us here today. My name is Sandra Musau. Welcome to Semana Dog is another episode in our series. We still go on in tackling the whole topic of emergency contraceptive pills. Today we are dealing with very common misconceptions that surround the whole topic. Yeah. So, and by the way, just to start with, what is an ectopic pregnancy? Ectopic pregnancy comes from the word ectopos, a Greek term that means out of place. So it literally means an out of place kind of a pregnancy. Normally, a normal pregnancy takes place within the uterus. If implantation occurs outside the uterus, then it's called an ectopic pregnancy. Some of the common places where ectopic pregnancies occur include a pregnancy within the fallopian tubes, within the ovary, or even in the abdominal cavity. Yeah. While ectopic pregnancy and the use of emergency contraceptive pills can occur as a coincidence, the truth of the matter is there is no any evidence-based information that supports the misconception that emergency contraceptive pills, or P2 commonly, predispose one or give someone a upper hand in getting an ectopic pregnancy. So it's basically not true. Most of the medical concepts are out of research. The relationship between ectopic pregnancy and hormonal contraceptive is an area that has been researched extensively, and there is no evidence that has shown that these P2s would make one get an ectopic pregnancy. Researches have been done locally here in Kenya. For example, there is an article that was produced, I'm not sure of the year, but it was produced and researched at Eldoret in Moi Teaching and Referral Hospital that only revealed have used emergency hormonal contraception. But remember, I said this can also occur as a coincidence. Yeah. So there's no substantial evidence to prove that ectopic pregnancies can occur due to emergency hormonal contraceptives. The other issue is how many tools should one take within maybe a cycle or even a year. Now, if you look at the Kenyan National Guidelines on Family Planning, it doesn't provide any specified number of pills one can take. In fact, the only disadvantage that P2s pose is that they are not effective when used over some prolonged period of time. They are inefficient, and they are unreliable to use. Yeah. So I hope we have unraveled the two most common misconceptions that surround the whole topic of emergency contraceptive pills. Yeah, thank you for watching up to the end. Again, you're always welcome to Semana Doc. You can also watch our previous videos on ectopic, not ectopic, but emergency hormonal contraceptive pills, and even other topics that you might be interested in. Yeah. So today just got me thinking from the news. Just seen the Ministry of Health proposing to cut down the stipend that is given to interns. But I try to wonder why taxes, or rather revenue, keeps on increasing. If you tax us more, or you tax us as Kenyans more, definitely the revenue goes up, and we expect maybe something should be increased in our pockets. I hope so. I think so. I stand to be corrected though by some of the economic gurus around. Of course, you can always share your thoughts on the same. Why we Kenyans are experiencing cut downs in terms pay cuts when actually the taxes are going up. Yeah, some of us are actually starving in some of these wards. Anyhow, see you in another episode. Yeah, bye.